do know today's the 28th. This is actually a slideshow that I prepared for our secretary who's visiting our region tomorrow, and things being what they are, I haven't had a chance to really tweak it that much for today. So just bear with me. I'm here primarily to tell a story, but some of the slides should help tell that story. So I guess part of the rationale for how this amazing project's come about is the work that our region has been leading for the last couple of years about trying to address the things that really affect people's lives in terms of health and well-being. And by and large, they happen outside the control of the health sector. The health sector typically catches people as they fall off the cliff, and this is about trying to improve the conditions that affect people's lives in these different forms of capital that Professor Trevor Hancock, one of the founders of the Healthy Cities program, uses to show that health, as we prefer to see it, is what he describes as human capital, which is what it's helping people achieve their maximum potential in all domains of their lives. And as you can see, you can't really achieve that until the other forms of capital are enhanced and improved. And typically, we often have economic capital driving development, which oftentimes depletes the other forms of capital. And so what we're trying to achieve in our engagement with the Aura and ANZ project is finding the right information that can help actually inform good planning decisions that integrate outcomes on those dimensions at the same time. And in terms of, I guess, the Healthy Cities approach, education and governance are critical to that, and we will be using this Aura and ANZ project to ensure that the Regional Management Forum, which I'll explain shortly, and all the other decision-making bodies can make good decisions based on really good information. Professor Billy Giles Kortai, who's one of the champions of this project, has been working with our Regional Management Forum and with us for a good couple of years now to show that the typical issues that are funneling lots and lots of people in increasing numbers into hospitals, doctor surgeries, primary care facilities around chronic disease, obesity, overweight, mental health, mental illness, they have their root causes in things that, as I've said, happen outside the control of the health department by and large, and they're happening right now in vast numbers on the edges of our city and also in the inner and middle urban areas. But this is particularly relevant to the Northern West region, given that we've got about 5 of 6 growth areas across Victoria. It's critical that decisions are made that can create real-time planning and implementation of infrastructure, social services, parks, transport. All the facilities actually will help to reduce the burden of disease and save money in the longer term by putting the effort into this. So Professor Billy Giles Kortai, we engaged Billy about 18 months ago to consult the Regional Management Forum, which is made up of CEOs of local councils, all 14 CEOs across our region, regional directors, which Sandy is a member. It includes Growth Areas Authority representation, Vic Roads, Police, Fire, Country Fire Authority, all the uniformed services. And it's about creating a better platform for decision making, sharing information and improving the linkages between state and local government. It's not a formal body with formal decision making powers, but by having the right people at the table, it's an incredible opportunity to influence good decision making both towards the state level and down towards the local level. And Billy's engagement with the RMF members, they identified 4 key areas that could help to improve people's lives in the longer term. Now, this rather complicated diagram is just to show you where our Regional Management Forum sits in the scheme of things. There is a new Public Health and Wellbeing Plan that's a key output of the Victorian Public Health and Wellbeing Act. This is all about governance, and it's all about influencing good local decisions and local planning and local collaboration. Each region of Victoria has an RMF, and we're really enriched by this partnership with the University of Melbourne. And one of the things that the RMF came across, decided on last much was the need for better data, the better need for integrated data that could actually inform local planning across the North and West. And because we'd already in the Department of Health had embarked on this implementation of the Public Health and Wellbeing Plan, we were very well positioned to jump at the opportunity to work with RMF members to see how we could shape up an integrated data initiative. And I guess we were just fortunate that the planets lined up. Bob Stimpson appeared out of nowhere, and Billy and all of the team. We came on board at the same time, and we were very fortunate to be able to put in a very detailed submission with the endorsement of the Regional Management Forum, and Jim Betts, who's our chair of the RMF and the Secretary of the Department of Transport, was instrumental in writing to other secretaries and getting their endorsement to share the data, or at least to explore what it would take for the data to be shared. We are working in an area-based way in our regional office, and again, this information will be incredibly important to us as we support and engage our health and non-health partners. So the integrated data project is very important for us as well. As you can see here, there's a raft of plans at the local level that councils typically have to try to coordinate and integrate. And I guess the value add of the integrated data initiative is that it will really influence and support much better local area planning that really has a fine geographical grain. So as you can see here, just to explain the RMF in greater detail, Department of Treasury and Finance, Justice, Human Services, Health, Department of Planning and Community Development, Education, Early Childhood Development, Sustainability and Environment, Regional Development Australia, the national body, which is almost like a national level of RMF, if you like. They have a representative there. Transport, Growth Areas Authority, Police, Fire Authorities, Business and Innovation, Big Roads, 14 councils. So the reason why this integrated data initiative is really important, I'm just going to skip over that, is there are several other governance structures at the state level that this integrated data approach can really influence, and we believe it has statewide significance. And I guess the importance to us in the region is that we are developing a resource that will have statewide application because of the wide remit of the data that's being collected. Most of it is state level. So there is the Victorian Prevention and Population Health Advisory Board, which is a whole of government initiative to attempt to create, I guess, a health in all policies approach to ensuring that the information we gather on transport, housing, employment, education and community services can influence the policy directives of the other government departments. There's also the Interdepartmental Governance Group for the the new Melbourne Metropolitan Strategy. And Jim Betts is also a member of the State Coordination and Management Council. So we see this initiative for the data integration project as really having the potential to inform, resource and influence these other very important levels of governance. We very much want the Melbourne Metropolitan Strategy to be based on good evidence, and Billy Giles Cortai, Associate Professor Caroline Weitzman and myself will be meeting the advisory committee for that particular initiative. So as you can see, this project is very significant to us in the Department of Health and very significant to the Regional Management Forum. It's one of the, it's a fantastic win for the RMF, and I think it's real testament to the value that I guess engaging in open-ended discussions about partnerships and collaboration can achieve. Sarah, I'm going to stop it there. Thanks.